Hello, everyone, and thank you so much for joining us for today's webinar, Climate Change is Health, the Breath and Heart of It All. My name is Diane Pickles, and I work for the American Lung Association, and I have the pleasure of moderating today's webinar for you, and I'm going to run through just a couple of quick logistics before I turn it over to the first speaker for today. We are keeping all of the lines of participants muted throughout the entire webinar because we have a very large listening audience, which we're very excited about. And so for sound quality, we're going to keep all of the lines muted throughout. However, we will take questions throughout at the end of the webinar, and you can submit those questions at any time throughout the webinar using the question pane or panel of the GoToWebinar box on your computer. So please feel free to submit your questions at any time, and as I said, we will respond to those questions at the end of the webinar. I also want to let folks know that we are recording today's webinar, and both the recording and the slide deck will be made available after the webinar. So no need to furiously scribble notes. We are happy to make those available to folks after the webinar, and at the end, we'll let you know how you can go about accessing those. So without further ado, I want to turn it over to our lead presenter today, Dr. Natasha DeJarnette. She is a policy analyst in environmental health in the Center for Public Health Policy, the American Public Health Association, and I will turn it over to her to kick us off.
Thank you so much. And thank you all for joining today's webinar, Climate Change is Health, the Breath and Heart of It All. My name is Dr. Natasha DeJarnette, and I am a policy analyst in environmental health in the Center for Public Health Policy at the American Public Health Association, where I lead our natural environment portfolio. This portfolio includes air and water exposures, as well as climate change. As part of the Year of Climate Change and Health webinar series, APHA is proud to co-sponsor this webinar with the American Lung Association, the Global Climate and Health Alliance, the U.S. Climate and Health Alliance, the Planetary Health Alliance, and the Medical Society Consortium on Climate and Health. This series explores the connection between climate change and key areas of our health. The science is clear. Climate change is a serious threat to human health. It can affect our health by way of harming our water supply, increasing vector-borne diseases, and increasing extreme weather events. Vulnerable populations, such as communities of color, the elderly, young children, and impoverished, as well as those with chronic illnesses, bear the greatest burden of injury, disease, and death related to climate change. As an APHA priority, we believe in the need for strong climate change strategies and interventions that protect people's health, and the public health community plays a critical role in doing so. Today's webinar, Climate Change is Health, the Breath and Heart of It All, will provide information on how air quality, particularly in a changing climate, impacts our lung and heart health. But first, here are some housekeeping items. We'll take questions at the end of all presentations, and you can enter a question at any point during the webinar by using the chat box. The slides and archived webinar will be available shortly after today's presentation. And finally, a survey link will be distributed at the end of the question and answer period. Please take time to fill out this important but short questionnaire to help us improve future webinars in the series. This webinar is part of the Year of Climate Change and Health series. The Year of Climate Change and Health is an APHA-led initiative with the goals of increasing the awareness of the health impacts of climate change and mobilizing action on climate change. We have a different theme each month to highlight key topics as determined by our members and partners. May is Air Quality, Lung, and Heart Health Month. June's theme will be Mental Wellness and Resilience. In addition to this webinar, activities in May also included Hill briefings to the U.S. House of Representatives and Senate, as well as several blog posts by APHA, the U.S. Climate and Health Alliance, the Global Climate and Health Alliance, as well as the American Heart Association. Please visit apha.org/climate to stay up to date on Year of Climate Change and Health activities. In June, we'll have an in-person workshop that will also be live streamed, as well as several blog posts, among other events. I want to note that the activities each month are partnership-driven. Each month, topic-specific partners come together to determine the month's activities. We would like you to get involved in the Year of Climate Change and Health. Whether partnering as an individual or an organization, your contribution will be invaluable. Bronze partners help share information with their networks or make lifestyle changes, for example. Silver partners assist in planning monthly activities or utilize energy-saving features. And gold partners participate in silver or bronze activities, along with hosting meetings, themes on climate change, or writing letters to the editor. Please visit apha.org/climate to learn more and become a partner. The burning of fossil fuels causes the release of carbon dioxide, which builds up in the atmosphere, trapping heat below, much like a blanket traps heat, causing the Earth's surface temperature to rise. This extra trapped heat disrupts many of the interconnected systems in our environment. One of the key climate change outcomes is decreased air quality. We have increased ambient pollutants, which are linked with respiratory and cardiovascular diseases. We see more hospital admissions for asthma and heart disease on poor air quality days. Longer, hotter, warm seasons are leading to longer pollen seasons. And the higher carbon dioxide is causing more potent pollen, making for longer and more intense allergy seasons. Drought is creating environments conducive to wildfires. And increased flooding is creating environments conducive to mold in our homes, schools, and work, which is troublesome for asthmatics. We have a right to clean air. We can't have healthy communities without healthy air. In the following presentations, we would like you to keep equity in mind as the presenters expand our understanding on air pollution, heart, and lung disease. Communities that live on the fence line of industrial polluters, such as factories, power plants, steel mills, etc., these communities have a higher air pollution burden. Communities that live near mobile sources, namely planes, trains, and automobiles, also have poorer air quality. Add in climate change, and this is exacerbated with worsening air quality and warming temperatures, which is also bad for air quality. Communities of color and impoverished communities are more likely to live in close proximity to polluting entities and thereby more likely to have reduced air quality, which Dr. Cushing will cover later in this webinar. Children are at added risk because their bodies are still developing, and elderly are more likely to have pre-existing conditions like heart or lung disease, and that makes air pollution even more hazardous. Follow the conversation on social media using the hashtags APHAwebinar and hashtag Climate Changes Health. For more information on how climate change impacts health, please visit apha.org/climate and view other webinars on climate change, including Climate Changes Health, Community Design and Transportation, or Climate Changes Health, Clean Energy Changes Climate. Without further ado, I'd like to introduce you to our moderator, Lindsay Mosley-Alexander. Lindsay Mosley-Alexander is Assistant Vice President and Director of the American Lung Association's Healthy Air Campaign, a national campaign to win strong outdoor pollution safeguards and address climate change to protect all Americans from the dangers of breathing air pollution. Previously, Lindsay has held positions with the National Religious Partnership for the Environment, the Energy, Environment, and Resources Center at the University of Tennessee, and Sierra Club. Lindsay holds a Master of Public Administration degree with a Certificate in Environmental Policy from the University of Tennessee and a Bachelor of Arts in Public Policy Analysis with a minor in History from the University of North Carolina at Chapel Hill. And with that, I'll turn it over to our moderator, Lindsay. Thank you so much.
Thank you, Natasha, and thanks to all of you for joining today's webinar. My name is Lindsay Mosley-Alexander, and I'm especially thankful to the American Public Health Association for your leadership in organizing the Year of Climate Change and Health and for organizing today's webinar. In addition to moderating, Natasha has asked me to share the findings of the American Lung Association's annual State of the Air report, and to identify some key policy priorities that help us in the fight for healthy air and climate action. So first, State of the Air report. Next slide, please. Next slide, please. Thank you. The American Lung Association started in the year 2000 a report to translate complicated information from local air pollution monitors across the nation into a report that into a report card that most people can understand. Did we skip a slide? I'm so sorry. Yes, this is the slide we want to be on. So this report focuses on ozone and particle pollution, which are the two most widespread pollutants. We grade counties that have monitors, and only about 900 counties across the nation actually have monitors, and we rank metro areas based on counties with the worst pollution in that defined metro area. And we've been tracking these changes long enough that we are actually seeing in our report some of the damage that climate change is causing in the air that many people breathe. Next slide. Ozone and particle pollution are dangerous and widespread. They can cause asthma attacks, heart attacks, and premature death, among many other health harms. And everyone is at risk, but some populations are more vulnerable. Next slide. Some of those who are most vulnerable, as you heard from Natasha, include children, those 65 and older, people with heart and lung disease, and many, many more. Basically, someone in everyone's family is at increased risk from air pollution. Next slide. And I'm going to move through the methodology very quickly so that we can get to the results and a little bit of the policy conversation. But essentially, we grade these two pollutants, ozone and particle pollution, by the number of days that levels spike and by the annual average level. The grading does not reflect the effort that states and local governments are doing to clean up. It's really just grading air quality, and California is a good example of that. Next slide. The report gives A to F grades for ozone and short-term PM based on EPA's Air Quality Index. And in the next slide, you can see that year-round particle pollution is different. It's graded on a pass-fail basis compared to the national standard for annual particle pollution. Next slide. So what did we find in this year's State of the Air report? The big news coming out of the report is that the Clean Air Act has driven major progress in the fight for healthy air. We're seeing lower year-round particle pollution, fewer high ozone days, and fewer people who are living in counties that earned an F for either ozone or particle pollution, and fewer by a lot. So right now we're seeing 125 million Americans in the 2017 report, which is down from the 2016 report, which showed 166 million Americans living in areas where either they had a county that had an F for ozone or particle pollution. Next slide. So this is tremendous progress, and it still remains that nearly 4 in 10 people live in counties with an F for air quality. Next slide. Clearly, we need to be doing more. And further, in addition to those who are currently living in an area that got either an F for particle pollution or ozone pollution, 18 million people live in areas that got all Fs. And furthermore, we are seeing dangerous spikes in short-term particle pollution due in part to climate change that pose an alarming threat. So let's dig into the news just a little bit. So 20 of the 25 cities who are most polluted for ozone had fewer unhealthy days in 2013 to 2015, which is the period that we look at for the report, the 3-year period for each report. 12 of those cities had their fewest days ever. 4 cities saw an increase, and 1 remained unchanged. Next slide. This is a list of the cities that rank as the 10 most polluted for ozone in the U.S. You can see that California cities dominate the list, but there's a growing number of cities in the Southwest in the top 25 most polluted for ozone. Most cities in the eastern U.S. that have previously dominated this list, along with California, have dropped off. Next slide. When it comes to particle pollution, we are seeing that 15 of the 25 cities most polluted by particles year-round had improved annual levels. 12 cities saw their lowest level ever, and then 8 cities had an increase in year-round particle pollution. 2 remained unchanged. Next slide. You can see here, and a lot more information is available on our website, so I'm moving quickly through this, but you can see here the top 10 most polluted cities for year-round particle pollution. These are actually the only cities in the U.S. that still fail to meet the 2012 annual PM standard. Again, California has the most on this list, but eastern and midwestern cities still have too much PM. Next slide, please. So why are we seeing these tremendous improvements? Well, one key factor is the Clean Air Act at work. Over the past few years, we have seen new emissions control equipment on coal-fired power plants, thanks in part to requirements of the Clean Air Act implemented by EPA. We've seen the retirement of coal plants, increased clean energy, renewable energy deployment, and then the turnover in vehicle fleets. We've gotten rid of old dirty diesels and brought cleaner vehicles online. Next slide. Now let's talk about those spikes in particle pollution. The report is showing an alarming trend in spikes in particle pollution, where you see here 15 of the cities most polluted by short-term levels had more high particle days in 2013 to 2015, and 8 had their worst averages on record. And when we've been doing this report for 18 years, and we see this trend going in the wrong direction. There were 7 cities that did better than previously and 2 unchanged, but in general this is an alarming trend. Next slide. And you can see here that these are the cities most polluted for short-term PM. And I would note that there are other western cities and even Alaska. Alaska is Fairbanks, which struggled especially with wood smoke. And Reno experienced smoke from wildfires, which is one of the reasons it is on this list. Next slide. So why are we seeing this increase in short-term particle pollution? Well, one of the major drivers of this is climate change. With decreased rainfall, increased drought, we're seeing more forest fires, grass fires, and dust, all which contribute to climate change, as well as other explanations such as weather inversions and continued reliance in wintertime on wood stoves. Next slide, please. However, when we look at this, our report is showing good news with some cause for alarm. And when you think about it in the context of the last few decades, I just want to point out that the progress is significant. We've seen a 71% reduction in the 6 common pollutants that EPA tracks, and this is a chart from EPA, and we've seen a 246% increase in GDP. You can see other measures of economic progress that we can track as a nation, and this goes directly counter to complaints from industry that cleaning up pollution, it hampers the economy or stymies economic growth. The evidence actually is quite to the contrary. Next slide. And then, of course, there's the cleanest cities on the list. Many of these have been on the list previously. I would point out that Wilmington, North Carolina is new to the list of cleanest cities this year. Next slide. All of the information that I have just provided and much, much more is available online at stateoftheair.org. The next couple of slides, I'll move quickly through these as well, just to give you a flavor of the information that you can find, because having information about the air quality in your home, in your community, can be very helpful, and also certainly can be helpful to patients if you see them. So what's on the site? All of the findings that I mentioned, the rankings of the metro area. Next slide. This is what it looks like for a county. This is the page for Harford County, Maryland, which is a county in the DC metro area. You can see there the grade for ozone. It failed, but we got an A for the annual particle pollution and passed for particle pollution. I'm sorry, we got an A for short-term particle pollution and passed for annual particle pollution. Next slide. And this is what it looks like for the metro rankings. You can see how your city or your metro area compares to others around the nation. And then next slide, we also are very pleased with the trend charts and to be able to track how counties have performed over time. And you can see the tremendous progress over time. Next slide. And just to give one example of that really illustrates progress over time, is just keeping with the same Washington-Baltimore area. Back in 1997 to 1999 report, there were over 90 days of unhealthy levels of ozone each year in Anne Arundel County. And this is using the 2015 ozone standard as the basis. For this year's report, it's much lower, down to just under 7 days each year. It's still high, but we've made a tremendous amount of progress. Again, this is thanks to the Clean Air Act. Next slide. So when we think about all of the progress that we've made, I want to make it really abundantly clear that I think all of us can agree that we can't afford to go backwards in the fight for healthy air, especially in light of what we know about climate change, which can make it harder for us to achieve progress in the fight for healthy air. Yet we find that we are facing significant threats from Congress and the current administration, and I want to flag some of those and make sure that you're aware of some of the policy threats that would threaten to take us backwards. So under the Trump administration, EPA has signaled an intent to pull back key air pollution protections. There have been, from President Trump and from Administrator Scott Pruitt, a number of announcements, related executive orders related to rolling back or pausing key clean air safeguards that are already on the books. The administration has also proposed massive cuts to EPA's budget, 31% cut. Last we saw, though, we're expecting the more detailed budget from the White House this week, and we will see likely substantial cuts, also cuts to state clean air programs. And EPA's got to have funding in order to monitor air quality and implement and enforce the Clean Air Act. And that is the only reason that we see the success that we've seen. Next slide. In Congress, there are many, many pieces of legislation that's quite popular and in vogue right now to introduce a bill to attack the Clean Air Act. But there are some that are dangerously, I think, under serious consideration by the Congress that would permanently weaken the Clean Air Act or weaken EPA's ability to implement the Clean Air Act. Specifically, regulatory reform bills would make it incredibly difficult for all federal agency to move any kind of a health safeguard forward by implementing a lot of burdensome requirements for review, trial-like procedures before regulations can be put in place, an adversarial context instead of an open, transparent rulemaking process that we currently have in place where the public and scientists and doctors can all weigh in. And then, of course, it's worth noting that Congress ultimately will decide the funding levels for EPA and has the ability to stand in the way of the administrative efforts to slash EPA's budget, but certainly they need to hear pressure from constituents to do that. So next slide. How can you help? We wanted to flag this, and we can flag it again at the end. Health professionals have an incredibly important role to play in this process by underscoring what's at stake and helping to let decision makers in Washington know that clean air protections are important to you. One of many ways is to sign on to a letter and join hundreds of other health professionals in all 50 states with a letter to President Trump and to those in Congress and to EPA Administrator Scott Pruitt opposing efforts to block, weaken, or delay the Clean Air Act. And I hope and would encourage all of you to sign your name to that letter and let your voices be heard. And with that, I'll wrap up my section of the presentation and move to our next speaker. So next slide, and then the next after that. So our next speaker is Dr. Aruni Bhatnagar. Dr. Bhatnagar is professor and distinguished university scholar in the Institute of Molecular Cardiology and professor of medicine, professor of biochemistry and molecular biology at the University of Louisville, where he has been since 1998. He is a distinguished university scholar and a fellow of the American Heart Association. His research interests include cardiovascular effects of environmental pollutants, atherosclerosis, injury from loss of blood to the heart or to the heart muscle, cardiovascular complications of diabetes and sepsis. Dr. Bhatnagar's work has led to the creation of a new field of environmental cardiology. He is currently serving on the editorial boards of both Circulation Research and Circulation, has participated in over 50 National Institutes of Health review panels, and is the author of over 120 publications. Please note, we encourage participants to send any questions through the comment section below, and we will ask them after the presentation. Thank you. Dr. Bhatnagar, you now have the floor.
Thank you, Lindsay, and good afternoon, everyone. Thank you for joining the webinar. You heard a lot about PM and the effects of what it can do, and so I thought in the next few minutes that I would discuss with you some of the general concepts and principles of the effects of PM, and then maybe share with you some of the results of our work, the type of things we are doing here in Louisville. So next slide, please. So we were talking about the general principles of the effect of the environment, and within that context, it seems that the cardiovascular disease or the diseases of the blood vessels in the heart are particularly sensitive to exposure to environmental pollutants. And this is because there is an intrinsic high vulnerability of the cardiovascular system to different pollutants, maybe because blood vessels circulate all the different pollutants that you breathe in, maybe because the blood vessels are not very good at removing or detoxifying different pollutants that enter the bloodstream and get deposited into different sort of blood lining. Next slide, please. So we know that air pollution is a major problem and is a major contributor to the global burden of disease, and most of the mortality, not in the United States alone, but anywhere else in the world, is in part or could be attributed to things like exposure to tobacco smoke, household air pollution, or ambient air particles. And therefore, this has become a major issue in our attempt to increase global health. First, to be able to identify the sources of these pollutants, and then to be able to understand their contribution, and hopefully to remediate or mitigate their influences. Next slide, please. So one of the major sort of miscreants in this level on different types of pollutants is, of course, particulate matter. And you heard about how PM could cause various health problems. It could come from many sources. The PM can come from natural sources or anthropomorphic sources that are man-made sources. They could be mobile sources or stationary sources. And depending upon the type of the source, the content of the PM or the constituents of PM vary. Next slide, please. And so most of the PM in urban environments comes from diesel and traffic sources. And these sort of levels of PM vary from one city and another city to another place, depending upon local sources, and then also some ambient sources. The PM could be both coarse particles or fine particles, and generally traffic generates more fine particles, where wood burning and so on would be coarser particles. And certainly the finer particles are much worse than the coarser because they go deeper inside the lung and get deposited in the deep lung. So it depends upon the city what the type of particle constituents are. In some cities, there is greater exposure to coal-derived particles. In others, there is a much more contribution of crystal material or fuel oil. And so it's difficult to study the health effects of these particles because they vary from one place to the other. And even within the same city, this could change with seasons and geography. So it is a very complicated area. But regardless, many studies have shown that just measuring particle size by themselves is sufficient to predict total health effects, and it doesn't relate so much to the composition. Next slide, please. So where are these particles? And we just heard from the American Lung Association that they're mapping different cities and so on. And this is a little bit an old map, but it is sort of PM10 distribution around the country. As you can see, that a lot of PM is being accumulated in the center or the mid part of the United States, in the Ohio Valley, downstream from Chicago and so on in Pittsburgh. And then there is also a spot here which we may not see so clearly, but it's Los Angeles. And then there is a spot around Birmingham, Alabama. But some of the worst air, of course, is in a small localized area, but very high levels of pollution is in Los Angeles area, the San Fresno Valley. And there's a joke in the field which says that Los Angeles is where good air goes to die. So we have different sort of concentrations and foci of high levels of air pollution, and then we can understand if in those areas if there is an associated increase in disease. Next slide, please. So this is backwards, forward, please. And if you see that there are the areas which have higher levels of pollution, are also the same areas which are associated with higher levels of mortality. So again, much higher or excessive mortality in California, and then in the middle of America and places where there is high levels of air pollution. So this suggests that wherever there is localized high levels of pollutants that are formed, there is higher levels of death. And the interesting part of this is that although exposure to air pollution causes a variety of different adverse health effects, but a majority, and I would say between like 80% of excessive mortality associated with exposure to PM could be attributed to heart disease. So we think that the effects of PM are primarily on the cardiovascular system, and we get increased incidence of acute myocardial infarction, stroke, and sudden cardiac death. Next slide, please. So the effects are, though, not restricted to the cardiovascular outcomes alone, and if you sort of map the levels of air pollution, particularly PM 2.5, you see that there's a close association between the levels of PM 2.5 in different communities and the incidence of diabetes in that community. So there is some data from such epidemiological studies, but in addition, in human panel studies, cohort studies, and also in animal studies showing that exposure to PM 2.5 can increase diabetes and even increase obesity. So we suspect that part of the current epidemic of diabetes and obesity that's unfolding is it could be related to exposure to bad air. And that's particularly problematic because as there is more climate change and global temperatures rise, that there will be expected increase in air pollution, but also chronic diseases. And so the mix of excessive exposures with excessive incidence of non-communicable diseases could have devastating consequences on global health, particularly in countries which have few resources to combat against climate change and changes in PM as well as disease management. Next slide, please. So in the lab and in our group, what we've been trying to do is to understand some of the effects of air pollution, and this is an example of one of our studies in which we recruited a lot of individuals with medium to moderate risk for heart disease around the city of Louisville, and this is shown by these dots around the city. And then we looked at the levels of stem cells in these individuals, and what we found was that people who had higher levels, or the days when they were exposed to higher levels of PM, had lower levels of coronary, these circulating cells, and also when they were exposed to other sort of pollutants, such as pollutant gases, or which you call gaseous co-pollutants, which come most of the time with PM, particularly from traffic exposure, that there was a decrease in the levels of these stem cells. Now, because these stem cells are required for repair, that it may indicate that constant exposure to air pollution may compromise the ability to repair blood vessels. Next slide, please. And so what we did is to look at the levels of these cells in individuals and associate that to proximity to major roadways. And we found was that people who live next to major roadways have poorer health. So now, if we are now sequestering people into busy urban areas with lots of traffic and lots of pollution, living in sort of congested spaces, there is more likelihood of increased risk of cardiovascular disease and increased cardiovascular mortality, as well as increased risk of developing diabetes and obesity. Next slide, please. And so we've been trying to figure out what to do with such a problem. And so one of these sort of solutions we are trying to work on is to figure out if we can increase greenness in an urban environment. Would that impact air pollution and cardiovascular health? And we are sort of launching this study to see if we plant a very sort of dense row of trees in a neighborhood, shielding it from exposure from major roadways, and from roadways within their neighborhood, how that would impact health and cardiovascular outcomes. Next slide, please. And so we know that there are areas where there is increased air pollution, that there is decreased levels of the greenery, that there's increased cardiovascular death. And this is a study that sort of shows that as there was a loss of ash borer or ash trees in the northern United States, there was a corresponding increase in cardiovascular mortality, suggesting that greenness is very critical for our health. Next slide, please. And so what we want to do in this study is to see if we can increase green spaces, would that decrease the risk of cardiovascular disease as well as the levels of air pollution. And so what we want to do is first go and survey the health of a community, plant the trees, and then do a post-planting evaluation to evaluate if the planting has changed not only the cardiovascular health outcomes in the community, but also stress levels, and psychosocial well-being, as well as outcomes, maybe lung outcomes and so on, and whether that would improve the health of a community by just increasing its green space. Next slide, please. And so as a sort of a test project for that, we've done a small project called Green for Good. Next slide, please. In this, we took a school in which was next to a busy roadway, and we exposed and we sort of planted a buffer of green trees between the major roadways and the school, and we found that just planting this green buffer decreased air pollution exposure and improved the cardiovascular biomarkers of health in the students as well as in the faculty in the school. So there's such efforts ongoing, and I think that part of the challenge is to understand where are the sources of these pollutants are, how are they affected by changes in the climate as well as other conditions, what can we do to assess the impact of these pollutants, and then more importantly, develop remedies which include mitigation of these pollutants by decreasing emissions, then also remediation strategies to improve the health of citizens and safeguard exposure from air pollution. So I would end there, acknowledging a whole range of people who work on this project and who have been sort of collaborating with us for a long time. Notice that Natasha is on the top of the list. She worked with us for many years on this project, and we continue to investigate and work on the issues that she sort of started here. Thank you very much.
Thank you very much, Dr. Bhatnagar, for that informative and really interesting presentation. Our next speaker is Dr. Laura Cushing. She is an assistant professor in the Department of Health Education at San Francisco State University. Her research focuses on the cumulative health impacts of environmental pollutants and social stressors in disadvantaged communities, and has investigated questions of environmental justice in the context of air pollution, prenatal exposures to man-made chemicals, and climate change. She has over 10 years of experience working in the nonprofit sector as a researcher, community organizer, and fundraiser, and often collaborates with community-based organizations in her research and teaching. Today, Dr. Cushing will discuss environmental justice and air quality in Southern California. And as a reminder, we encourage participants to send any questions through the chat. We will ask questions at the end of the presentations. With that, I will turn it over to you, Dr. Cushing. Thank you.
Thank you, Lindsay. I'd like to build on the work you've just heard about the health impacts of air pollution and share with you some of the research I've done with colleagues here in California, where the state is trying to aggressively reduce greenhouse gas emissions in order to slow climate change. So I will talk about the potential implications of those efforts for air quality, and particularly for environmental and health equity. To first put this into perspective, I wanted to at least give a snapshot of how air pollution is already very unequally distributed in California. There have been many studies documenting this, and this slide is just an example from my own work looking at racial disparities in residential proximity to many different environmental hazards across the state. The chart on the right is one way to visualize these racial inequalities. This plot orders all zip codes in the state from those that have the highest proportion of residents of color on the left, so the most highly African American, Latino, Asian, or Native American neighborhoods, to, on the right, the zip codes with the highest proportion of non-Hispanic white residents. Each line represents the cumulative share of different environmental hazards that the residents of these zip codes face.
Several of these measures relate to air pollution, including the one I've circled, which is diesel particulate matter. The diagonal line in bold is what it would look like if environmental hazards were equally distributed. But what we see is that instead, all of the curves on this plot are above that diagonal line, meaning that all of these hazards disproportionately impact communities of color. Looking again at diesel particulate matter, the orange dot, for example, indicates that the half of neighborhoods with the highest proportion of residents of color host about 80% of the diesel particulate matter emissions in the state, while the whitest zip codes on the right half of the plot host only 30%. The maps illustrate what this looks like for one example area, the San Francisco Bay Area, where we see that the darker orange areas with higher diesel particulate emissions largely correspond with the darker purple areas that have higher proportions of residents of color. And while efforts under the Clean Air Act, as Lindsay described, have made significant progress in reducing overall background concentrations of ambient air pollution, they have not adequately addressed the problem I'm showing here, and that is the inequalities in exposure. And that's because they haven't necessarily addressed the localized pollution hotspots that contribute to these inequalities. Next slide, please. We have reason to believe that climate change is going to make this picture even worse. Climate change worsens air quality through a number of mechanisms. One of them is that warmer weather facilitates the formation of ozone, or smog, and particulate matter from precursor pollutants in the atmosphere. So the study I'm showing here from researchers at MIT tries to predict how climate change will impact air quality over the next century. The pink and red areas are those parts of the U.S. that are likely to experience higher concentrations of these pollutants as a result of climate change. And looking at California in particular, the places in red are places that are already out of compliance with national ambient air quality standards. And these are also regions like the greater Los Angeles area and the San Joaquin and Imperial Valleys that are home to large segments of the state's low-income populations and communities of color. The flip side of this is that efforts to slow global warming can benefit health and potentially lessen environmental injustice by improving air quality in disproportionately impacted communities. Next slide. California has taken a leadership role in addressing climate change by adopting some of the most ambitious greenhouse gas reduction goals in the world. The passage of the Global Warming Solutions Act in 2006 made California the first state in the country to adopt a binding limit on emissions, and that emissions reduction target has since been strengthened even further with the passage last year of Senate Bill 32. These policies were real wins for environmental justice and for health equity because, of course, disadvantaged populations will experience the most severe health and economic impacts due to global warming. But they were also a win because these policies offered new hope that environmental justice communities who live on the fence line of polluting industries would begin to see reductions in air emissions in their neighborhoods. That is because when you emit greenhouse gases out of a smokestack or out of a tailpipe, you also emit many of these health-damaging co-pollutants. Several studies have suggested that the cost of reducing greenhouse gases, in fact, are outweighed by the savings associated with the prevention of illness and death due to improvements in air quality. So we wanted to look at one of the programs California has adopted to try to meet these ambitious goals, and that is its cap and trade program. Next slide, please. This program aims to reduce emissions from large stationary sources. For those of you who may not be familiar with cap and trade, under this system, companies are given or must purchase allowances, or basically permits to pollute, for every ton of greenhouse gases that they emit. The total number of allowances is set by a statewide cap that decreases every year. The idea is that by allowing companies to trade allowances rather than capping emissions at each facility, reductions can be achieved more cheaply. A company can choose to reduce their emissions and sell their excess allowances to another company who faces greater financial barriers to reducing emissions at their own facility, minimizing costs overall. So trading under this program began in 2013, and revenues from the sale of allowances are being reinvested into additional greenhouse gas mitigation projects. At least a quarter of those revenues must be invested in ways that benefit disadvantaged communities, which could bring additional benefits in terms of environmental justice. But I'm not going to focus on the revenue side of things here, but instead on the emissions themselves. The next slide illustrates how the health benefits of this program really depend on who chooses to reduce their emissions and where those reductions take place. On the left is a power plant near Bakersfield, California, and on the right is an oil refinery near Torrance. Both facilities emit about the same amount of greenhouse gases, but the refinery emits almost 10 times more particulates than the power plant. There are also many more people living near the refinery. By allowing these facilities to trade with each other, we may miss out on the more substantial health benefits that would happen if emissions reductions were to take place at the refinery. And this has been one of the major critiques of cap and trade from environmental justice advocates. When we looked into this issue of where emissions reductions under this program might happen, we unsurprisingly found that people of color and people in poverty were more likely to live near greenhouse gas emitting facilities. The charts on this slide, thank you, show the number of regulated facilities within 2.5 miles of census block groups with respect to the racial or ethnic makeup of the population, shown in red, and in black, the proportion of the population living in poverty. And what we see is that the higher the number of facilities nearby, the higher the proportion of people of color and people in poverty in those neighborhoods. Unfortunately, we also found that at least so far, the program has not led to the hoped-for decrease in local greenhouse gas emissions in these communities. In fact, we've seen an increase in local in-state greenhouse gas emissions since the advent of the program, which I've circled here on this slide. That is likely due to a couple of factors. One is that the statewide cap on emissions was probably too high to exert much pressure on companies to reduce, especially since emissions were still rebounding from a low in 2009 that resulted from the recession. The other is that under this program, companies can use other means to meet their compliance obligations. One is that utilities can purchase cleaner in-state electricity in place of purchasing imported electricity from out of state, which tends to have a higher carbon footprint. Another is that companies can use offset projects instead of reducing their own emissions, and I'll return to the issue of offsets in a moment. This has meant that the program can claim to have reduced greenhouse gas emissions overall, while in-state emissions continue to rise. Next slide. Looking at this increase in emissions by sector, we see that on average, several industries increased their emissions after the advent of the program relative to the 2 years prior. The diamonds in this plot represent means, and the bold lines show median changes in emissions, and when they are above zero, this indicates an increase. In the next slide, we wanted to look at this issue of co-pollutants. And this actually turned out to be a real challenge because the emissions databases are not integrated and don't currently talk to each other very easily. But what we found after much wrestling with the data was that the facilities that emit more greenhouse gases also emit more particulate matter. And I'm showing PM 2.5 here on the y-axis. The steepest slope is amongst metal and machinery manufacturers, while the tightest correlation is among cement plants. But overall, for all but one sector, we see a statistically significant correlation between these two pollutants. Moreover, in the next slide, we see that when facilities increase their greenhouse gas emissions, they also tended to increase their emissions of hazardous co-pollutants. And that's true not just for PM 2.5, but also for NOx, SOx, and volatile organic compounds. What this graph shows is that per 1% increase in greenhouse gases, on average, facilities also increase their co-pollutant emissions between 0.2 and 0.4%. Next slide. Returning to the issue of offsets. Offsets are greenhouse gas reducing projects that companies can use in lieu of reducing their own emissions under the cap and trade program. In fact, companies took advantage of these credits quite a bit. The orange bar shows the total emissions that were covered using offset credits during the first 2 years of the California's program, and the amount swamped the total decrease in emissions during the same time period, which is shown in the gray bar. The pie chart shows that these credits were largely generated by projects outside of California, mostly involving destroying ozone-depleting substances and modifying logging practices in forests. The companies that were the largest emitters of greenhouse gases were also the most likely to use offset credits. with the top 10 offset users accounting for over a third of greenhouse gas emissions covered by the program. Next slide, please. So in summary, we found that greenhouse gas emitting facilities are located in neighborhoods with higher proportions of people of color and residents living in poverty. And on average, the cap and trade program did not result in the hoped for decrease in local emissions, at least not so far. Instead, in-state greenhouse gas emissions for several industries have on average increased in the 2 years since the program began, with many high-emitting companies using offsets to meet their obligations. And finally, at the facility level, increases in greenhouse gas emissions have been accompanied by increases in hazardous co-pollutant emissions. Next slide. In terms of recommendations, it's clear that the public health and equity co-benefits of greenhouse gas mitigation efforts could be enhanced through more localized emissions reductions. And this is important to emphasize because many jurisdictions are now looking to California as a leader and a test case for how we move forward in terms of climate policy. A secondary recommendation is that in order to really track the health and equity implications of these efforts going forward, emissions reporting requirements need to be harmonized to facilitate the kind of analysis we've done here. Thankfully, both of these considerations have actually made it into new legislation that was passed in California last year. You can read more about the work I've shared with you in a preliminary report released last year with co-authors at Berkeley and the University of Southern California and Occidental College. And I welcome your comments and to hear more of your questions later. Thank you.
Thank you so much, Dr. Cushing, for that excellent presentation, and I am sure that we will hear more from you again during the question and answer period. Turning to our next speaker, Denny Cawley is the Executive Director of Utah Physicians for a Healthy Environment, a public interest environmental nonprofit dedicated to protecting the health and well-being of Utahns by promoting science-based health education and interventions that result in progressive and measurable improvements on the environment. Denny cultivated partnerships and managed programs over the last 15 years for U.S. and international organizations in the areas of environmental policy, good governance, human rights, health, and education. And once again, participants can send questions for the presenters through the comment section. We will ask them at the end of presentations. Thank you. And now I'll turn it over to you, Denny.
Hi, thank you for the introduction, and hello to everyone. Good afternoon or morning, depending on where you're listening from. So I'm the Executive Director of Utah Physicians for a Healthy Environment, and UPHE is a nonprofit based in Salt Lake City that is dedicated to the health and well-being of Utahns. For the last 10 years, our doctors and our community members have raised our concern over air quality and other sources of environmental pollution. Next slide, please. So around December, I received a short email out of the blue from Linda Rudolph of the U.S. Climate and Health Alliance, and she asked if we were interested in an opportunity to do a pilot project with their group and the Global Climate and Health Alliance and the Global Call for Climate Action that will involve 4 to 5 cities worldwide. So this pilot has now become the Unmask My City campaign that involves 10 cities in 5 continents. Next slide. Today, I will cover some information on air pollution, climate change, and what we should probably call the climate crisis and their health impacts, and also talk about the Unmask My City campaign and our local contact initiatives in Salt Lake City. Next slide. Air pollution is driving a global public health crisis. It is responsible for 1 in 9 deaths worldwide and touches almost everyone. It is a driver of the climate crisis with increasing heavy health implications. So you'll see here 6.5 million premature deaths are caused by air pollution each year, and nearly half of them are due to outdoor air pollution. 80% of people in urban areas are exposed to air pollution levels exceeding the World Health Organization's safety limits. Also, 98% of low and middle income countries fail to meet WHO standards. So in 2015, world leaders set a goal of reducing the number of deaths and illnesses from air pollution by 2030. So as Lara had mentioned, there are real co-benefits of reducing carbon emissions and air pollutants. Quote from our fact sheet: reducing air pollution improves health outcomes while also reducing emissions of major climate pollutants, including CO2, black carbon, and methane. And there are follow-on economic and social benefits. There are also expected health impacts from extreme weather caused by climate change. Especially here in the West, you would have flooding, wildfires, and you see increasing spread of vector-borne diseases. Next slide. So as many of you know, there are numerous studies documenting the adverse health impacts of air pollution. It affects almost all our systems. This includes asthma attacks, increased risk of heart disease, lung cancer, respiratory diseases, and strokes. A new study documents that toxic nano-sized particles called magnetites that are found in air from air pollution end up in our brains. So people with higher concentrations of the metallic nanoparticles are known to be at higher risk for Alzheimer's. And the kind of brain damage these magnetites can cause are consistent with the disease. You're also aware of how traffic pollution can affect the breathing of young kids, how diesel emissions are considered carcinogenic. There's a new study in London that showed how inhaled nanoparticles, like those pumped out from vehicle exhaust, can work its way to the lungs and to the bloodstream, where they can raise the risk of heart attack and stroke. And also even short-term spikes in air pollution definitely affects fetal development. Next slide. So doctors, nurses, public health practitioners, and other healthcare professionals are coming together to call for practical solutions to cut pollution levels in cities and also deal with both air pollution and the effects of climate disruption. So World Asthma Day, Unmask My City was launched. Our groups are using air quality monitors, smartphones, innovative LED light masks, and these change color according to the pollution levels to highlight the preventable and direct impacts of air pollution. But what they're saying is that wearing masks is not enough. It's not a solution. Next slide. So these slides show some of the images from the campaign in the 10 cities listed. So in the next slide, if you go to www.unmaskmycity.org, it will lead you to different city sites with city fact sheets and a call to action related to specific policy acts. This includes transit solutions for vehicle emissions and also moving away from fossil fuel extraction and better monitoring. Next slide. So these are just some of the policy acts and policy changes that we're asking for. Basically transition away from dirty coal, blocking construction of new coal power plants, and increased monitoring and regulating air pollutants. Next slide. So first of all, Lake City, we face unique challenges due to our geography, especially when fine particulate matter and other pollutants are trapped in what is called an inversion layer. So this is when a layer of warm air traps cold air, and everything in it becomes extinct, and everything's trapped in there. We also, during the summer, have high ozone levels. So both fine particulate matter and ozone causes inflammation in the lungs. So an increasing population, perhaps what I would call uneven regulations on air quality, more of these harmful emissions are trapped in our valley. So in 2014, we were one of the top 5 states for high carbon intensity of energy supply, and the use of coal is a major contributor to air pollution. If from the Division of Air Quality, if you look at what fills this inversion layer with smog, you have 48% of pollution coming from mobile sources such as vehicles, 39% from area sources such as homes and buildings, and 13% from industry point sources like refineries. But this doesn't really capture, let's say, accidental releases and other types of releases. And so we were EPA reclassified these as non-attainment areas in Salt Lake City and Provo as serious for not attaining the federal ambient air quality standards. So this basically says our air is bad. Next slide, please. So to quote from our winter fine particulate study, particulate matter exceedances have been specifically associated with adverse health effects in the region. This includes 42% higher rates of emergency room visits for asthma, and a 4.5 increase in the risk for acute ischemic coronary events. So we have an increasing steady rate of emergency visits due to COPD, asthma, and other causes. 9% of adults and 7% of kids have asthma, which is slightly above the national level. Dr. Patnagar and Dr. Arden Pope has worked on a study that shows how the levels that we experience here can affect healthy young adults in terms of their damaging the lining of their blood vessels, and so this shows that even if you're healthy, there is an effect on you. And then it was also touched on earlier that the American Lung Association released the State of the Air report, and our area was shown 7th worst for short-term particulate pollution. And also we broke into the rankings for ozone pollution at number 20. Next slide, please. So UPHG and 4 other local partners launched our Unmask My City campaign locally, and we included a petition on these policy acts. We are asking Utah leaders and lawmakers to reprioritize the health of the community, because they have to come up by the end of this year a state implementation plan to meet the federal regulations by 2019. And some of the areas we want them to really focus on is supporting, ideally, statewide diesel emissions testing, but that's also going to be a bit of a challenge. We want to prevent any water diversion projects that affect the inflow of the water to the Great Salt Lake. There's a proposed Bear River Lake diversion, and the Bear River provides 60% of water to the Great Salt Lake, which has decades of mercury and other heavy metals being dumped into that lake, and an exposed lake bed and increased dust storms would definitely affect the community around the lake. We want better air quality monitoring, and also more regulation of the toxic dust that really affects the community, especially from gravel pits and mining operations, because this is not, there are no standards in terms of the EPA, but there are standards for occupational safety. So I especially commend the Salt Lake County and Salt Lake City in their leadership. The mayor of Salt Lake City announced a comprehensive plan entitled Climate Positive 2040, and they detailed ways that the city will sustain its leadership role in addressing climate change. We have a very small window to reverse or mitigate the course of climate change and air pollution, especially when around the world, people are affected right now. So I hope you check our unmaskmycity.com page, .org page, and basically want to say everyone deserves to breathe clean air and enjoy a stable climate. And this is a year-long campaign that will bring the message to health professionals, will bring the message to leaders and to the community. The changes happening nationally will affect us locally in Utah, especially the EPA budget cuts. And many of our leaders will still not acknowledge climate change. So we really want to start this discussion from the grassroots level among those who will see the health impacts, and these are our health professionals. So the last slide just shows the partners in the Unmask My City global campaign. Thanks so much.
Thanks so much, Denny, and thanks to all of our presenters. We are now ready for your questions, and we'll take some time to answer them. So if you have a question for any of the presenters, please take a minute now to enter your questions through the chat feature, and we will compile questions and start to move through those in just a moment as people are entering them in. And I will take this moment just to remind you that after the webinar, you will get by email a brief online evaluation of today's webinar, and we would really appreciate you taking just a very quick 30 seconds to share your thoughts on today's webinar by filling out that brief online survey. This will help us just improve future webinars, so we value your feedback. The link was shared in, I think can be shared in the chat box, and it will also come to you in an email after today's webinar. So thank you. Let's see what questions we have. So the first question, we will just dive in. I believe Dr. Bhatnagar would be a great person to answer this question. Is there a safe level of particulates?
There's been a lot of debate about that. Not really. There is no safe level. There is a linear relationship in health outcomes, particularly cardiovascular mortality, from low levels, starting essentially from 205, the lowest we've ever measured, microgram per meter cube, and then it goes and sort of saturates around, say, 50 or 100, and so the dose response curve is non-linear. So at higher levels, the effect seems to level off, but there is no sort of safe level or threshold that's been established so far.
Thank you. And while you have the floor, a couple of other questions that I think that you can help shed some light on. So could you say a little bit more about the relationship between air quality, diabetes, and obesity?
Yes, so in some epidemiological studies, there is evidence, as I showed, that there's in areas of high levels of PM2.5 have high levels of diabetes. That study did not find an association between obesity. But there have been other studies, there have been studies with certainly black women in Los Angeles, I remember, who had higher levels of insulin resistance in areas with high levels of air pollution. They have also done panel studies in which they take people from low levels of air pollution to higher levels of air pollution and bring them back, and within a few hours they could see differences in insulin resistance in these individuals. There was a couple of studies from Canada showing greater incidence of diabetes in more polluted areas. And finally, there are some studies from animal models which have shown that if you expose animals to high levels of air pollution, they develop diabetes when they are on high-fat diet. When they are on normal diet, the effect seems to be marginal. But they also have greater weight gain and greater insulin resistance on high-fat diet when they are concurrently exposed to high levels of PM2.5. So that's kind of the aggregate of the evidence we have so far. So some other studies, larger studies, are undergoing in which we can track exposure to longitudinally to see there is a temporal association between exposure to PM2.5 and the incidence of diabetes.
Thank you so much, Dr. Bhatnagar. Just to follow up on that, and I'm going to combine a couple of questions here. If heart disease and diabetes are linked with air pollution, the question is it safe to work outdoors? And potentially a related question is, I wonder if the face masks like we see in Asia are useful in filtering out pollution, and if so, what is important to look for in those filters?
So yes, there is some concern that there is greater absorption of particles if you are working outside, especially on days of high pollution. So generally, it's recommended that the activities could be indoor. But mostly, there are filters available for, like HEPA filter for indoor cleaning and purification of air, and those seem to be useful. Now, the masks that people use in China and in India and developing countries can remove air pollution, although there have been no randomized controlled trial, although I believe one is underway in China. And so these are masks that will remove particles less than 2.5 microns. So if you have a mask that says it's going to remove fine particles, and some of them do, some of them are quite efficient in removing these, then those might be the most appropriate ones to use in days of high air pollution.
Thank you very much. Dr. Cushing, a question for you. Are you able to comment on cap and trade compared to carbon fee with dividend?
Well, I think there's, I can comment. I don't know how informed my comment will be. I don't consider myself an expert on all of the policy options, but I think there are benefits to providing a clear price signal on carbon, and under cap and trade, the price of these allowances go up and down, which can make it a little difficult for companies to plan and invest accordingly, because they don't know what the price will be in the future. And in fact, in California, the price really dropped and basically hit the floor on the lowest price that these allowances can be. So I think that's one benefit to this. and also sending one, and I'm not sure how this would work unless if we had a national policy around carbon tax. But leakage is a big issue with the cap and trade program here, because of course I mentioned that utilities made a switch to purchasing more in-state electricity rather than importing electricity from out of state, which tends to have a bigger carbon footprint. But the problem with that is that, of course, that electricity that was produced out of state didn't just disappear. It, was sold and used elsewhere, and these grids are connected. So in some ways, that may have just displaced the pollution outside of the state. And so really addressing this on a state-by-state basis is not the way to go, and having a firm price that is throughout the country would, I think, be much more effective.
Thank you. Related to that, I'm just trying to sort of tie some of the various questions together. So is there, and you may not want to elaborate further, but from your presentation, people of color and poor people are in high polluted areas. What policy change is most effective to help those people? And I think others, Dr. Cushing, you can start, I can comment, and others can probably comment on that as well.
Well, I think policy that directly addresses issues of inequality is needed. And much of our efforts on clean air have focused on reducing regional air quality problems, which is a good goal, but again, doesn't get at this issue of pollution hotspots. And the more, we have more sophisticated ways to measure pollution now that are starting to show, including mobile sensors, personal wearable devices, etc., that are really starting to show how heterogeneous within a city pollution can be. Like from one block to the next, the levels can be very different. So that should enable new policies that try to reduce the sources of pollution that are really contributing to those hotspots, whether they're transportation or large point source polluters like I discussed in my presentation.
Thank you.
I don't know if others want to add to that.
Yes, what would others like to add, if any?
Hi, this is Denny. So at Salt Lake City, there are, the areas, low-income areas are surrounded by, the highways, the refineries, and as Lara said, having community monitors is important, especially when there's not enough funding to put federal air quality monitors. And the microenvironment is very important, because you'll have also communities that do a lot of wood burning, and wood burning is also pretty toxic, especially to your neighbors. So just being able to identify these hotspots with these community monitors can raise that to the appropriate health agencies. There's a study at the University of Utah where they put air quality monitors on the track system, which crosses the city north to south and west, east to west, and it's really good at identifying where these hotspots are, and hopefully changes can be made when they see the sources. Unfortunately, a lot of this also involves being near a highway, and that's where really long-term regulation is needed for improving for reducing vehicle emissions that affect these communities that are vulnerable.
Lindsay, if I could jump in again, this is Lara, and just share that the other thing to keep in mind that's important is that we have emerging more and more evidence that communities of low socioeconomic status may actually be more vulnerable to the effects of of poor air quality for a number of reasons. And so another sort of effort that California has begun is to look at the overlap of social stressors to health and environmental stressors to health, and to focus efforts in communities that are high in both social and environmental stressors. So I would say that's another route where policy could, and this is something that environmental justice advocates have been pushing for a long time, is to look at this issue of quote unquote double jeopardy, where not only is the air pollution worse, but also the community is more vulnerable and has less resources to mitigate their exposure and recover from illness, for example.
Thank you. Any other comments on that question? All right, we'll go to the next question. So there are a couple of related questions here, really considering the political context that we're currently in. So what messages can we use that work across political lines to express the importance of protecting clean air? And how can we convince industries and Republicans that reducing pollution is a good economic strategy? So I think those are a couple of related questions. I will start by pointing back to the chart that I showed you, EPA's chart, that very clearly illustrates over time that successful policies to address pollution at the federal level have reduced ambient air quality pollutants, so have improved ambient air quality, while other markers of economic activity and strength, including GDP, vehicle miles traveled, and others, have gone up. And so one thing is just to note that the facts are very clear on this point. And so, you know, part of it is an education effort, is to just make everyone aware, not just Republicans, but Republicans and Democrats alike, to help educate and raise awareness about the success of the Clean Air Act in reducing pollution, saving lives, and improving health. And the second thing that I would say to that, in particular, I think is relevant for all of you who are gathered here, who have a connection and a role in the health community. Your leadership and your voice is incredibly valuable. Health professionals are among the most trusted members of our society when it comes to articulating what's good for our health and what's dangerous to our health. So doctors, nurses, respiratory therapists, public health officials, all of you who are working day in and day out on the front lines of protecting people's health, you have a role to play in making your voice heard about what is at stake, and really sharing your perspective with your elected leaders. And that, I think, is very important for Republicans and Democrats alike to hear from the health community, particularly because your voices are less more credible and perhaps less political. So I think that you can use that to your advantage, and we can all benefit from the education efforts that you can undertake. Would any of our other speakers like to comment on that?
I would just like to add that we could point out to evidence saying that improving air quality does make a positive difference. There are a couple of studies showing that cities in which they have cleaned up the air have seen an average 3 to 6 months increase in average life expectancy of a person in that city. So that means a lot, that there are actual health benefits of following down the same route and not sort of making a U-turn, because then we would be in a position where there would be excessive disease. And so I think that maybe one part of the message might resonate with some people.
Hi, this is Dani. I also want to add, financially, the health cost of outdoor air pollution is $1.7 trillion in 2010 for the 35 OECD member countries. And another good resource is like talking to the community. Eco-America brings out really good points. They said in their surveys, 83% of Americans agree that clean air is a personal right, but only 25% of Americans recognize that climate change affects our health. So they have a great document which is about Let's Talk Health and Climate, and it's communication guidance for health professionals. And even simply changing some languages, such as not using we should, but saying we can, and make it really more personal rather than talking about stop, mitigate, or slow down climate change, talk about create healthy, safe communities. I think this is language that people who are at the border, who are just beginning to open up and listen about climate change and health and urban air pollution can really be brought in. And again, just to echo the fact that health professionals play a big role in this.
Thank you, Denny. Here's a question for Dr. Cushing. Have you looked at port city diesel pollution in particulate and asthma rates in children? I'm sorry, I think that should be in particular in asthma rates in children. And have you looked at any of the data from the Children's Health Study?
Personally, I have not. Ports are a big issue here in California. We have several large ports that contribute a lot both to climate change and to poor air quality. So I know that's an active area of research and concern, but I haven't personally done research in that arena myself.
Okay, thank you. Here's a question I think everyone may be able to comment on. What makes children more vulnerable to air pollution? Dr. Bhatnagar, would you like to start?
Yeah, because children are in the developmental phase, and so they are more likely to be affected. There are lots of different processes in development that can be affected by air pollution. There were studies from Germany showing that children who are exposed to record air pollution might have lower development levels, IQ levels, and so on. So that makes them more vulnerable because their metabolism and the metabolic rates are higher than adults, and so they would breathe in more per body mass, and so therefore there is a greater exposure to them. And then also children are more likely to be outside than adults, so there is a greater vulnerability because of that. They don't have a whole range of the metabolizing enzyme that can remove some of the co-gaseous co-pollutants. Some of the P450s and so on are not so well developed in children because their metabolizing capacity is still immature, and so that makes them even at a greater risk.
Thank you. Would anyone else like to comment on the vulnerability of children? Okay. Here is a comment that I think I will share, even though it is there's not a question embedded in this that says, I just came from the Congressional Management Foundation's webinar on legislative correspondence, and they said it takes less than 10 personalized emails from leaders of an organization to influence a congressperson who's not yet formed an opinion on an issue. I would imagine that personalized correspondence from health professionals would carry some similar weight as well. And I think that's a good illustration and reminder that it doesn't take a lot of necessarily a lot of people if the right people are sending the messages to decision makers in Washington. So certainly hearing from health professionals is very, very important. Well, we have just a couple of questions left, so I will move to the next one. Can any of the presenters comment on policy options to reduce the health and climate effects of residential wood burning?
Well, it is an important problem. First is there needs to be a certain amount of transition from wood burning to other sources of fuel. Second, there is, at least in the developing world, wood burning is indoors, and so there are types of gas stoves that can be used that would minimize exposure inside the house, because otherwise there are very high levels of pollution. Of all half the deaths attributable to air pollution are because of this solid fuel burning indoors. And so there are some types of stoves that have been developed by the EPA that have been installed in different parts of the world that could reduce exposure. So that's one possibility. In the United States, there is wood burning is sometimes just to heat, and so there could be, the way to do is to minimize exposure to that is to have good ventilation and have that removed as soon as it's formed, and better still to switch on to other means of heating rather than just wood burning.
Hi, this is Danny. Also, just to add on the toxicity of wood smoke, there's a study from researchers at UCLA that show the linear relationship between intrauterine polycyclic aromatic hydrocarbons exposure, and the loss of brain white matter. This basically means a mother who is exposed to these PAHs, which can be found from burning organic material, their children later on have shown a loss of brain white matter, and this correlates with the loss of intelligence and behavioral disorders. So we found there are recent studies here in the Salt Lake City area that even during our red air days, people are still burning wood. And they've done programs where they change out some of the stoves, but some people just still insist that this is something that they do. It's a cultural discussion, and I think it's a difficult discussion as well. So, you know, much like it took years for cigarette smoking to be seen as something that is really bad, I think this is the start of a conversation for wood burning and wood smoke.
And this is Lindsay. I can say that there have been some very successful wood stove change-out programs that provide incentive and support for people to upgrade their wood-burning stoves to the latest and most stringent stoves that have pollution controls that the old stoves don't have. So there can be a way there to encourage people to use cleaner devices, which may not be the ultimate solution, but can certainly help with reducing pollution. Let's see, just a couple of more questions. Okay, here's a question on that I'm not sure which of you might want to take. What is the state of the science on ultrafines, nanoparticles, and when might there be sufficient weight of evidence to press for a related ambient air quality standard?
That's a very controversial issue. Some people fervently believe that all the toxicity of air pollution is because of ultrafine particles, but they're difficult to measure and the effects are difficult to study because these are fresh emissions that come out of, say, automobile exhaust, and within 50 meters of the roadway, they die up to near 90% of their concentration and congeal to form fine particles. So therefore, there is not good evidence, and I'm not sure when the regulations would appear, but even the data with the toxicity is still spotty.
This concludes this portion of the webinar. We want to remind you that none of the Year of Climate Change and Health activities would be possible without our partners. So please visit apha.org/climate to become an individual or organizational partner. Next up, we have a workshop on climate change and mental health, and it'll be from 12:30 until 3:30 on June 12th. For more information, once again, please visit apha.org/climate. On behalf of the American Public Health Association, American Lung Association, the U.S. Climate and Health Alliance, the Global Climate and Health Alliance, and the Medical Consortium on Climate Change and Health, we appreciate your time and participation. This concludes the webinar.